Let me start with a question. How many of you have a patient or are somebody that's taking an antidepressant? Okay, it's usually about 20% of Americans. Now, let's think about something a little bit differently. How many of you know the vitamin D levels? In medicine, we routinely check cholesterol before starting a statin. We routinely check hemoglobin A1C and glucose before treating diabetes. But one of the hormones that affects the brain, the immune system, muscles, bones, inflammation, and even resilience to stress often goes completely unchecked. So today I want to spend a few minutes talking about vitamin D, not as another supplement trend, but as an evidence-based, functional medicine-informed biomarker that can help optimize both physical and mental health. I'm Dr. Arwen Podesta, a functional psychiatrist, triple-boarded in psychiatry, addiction, and forensic psychiatry. On this channel, we break down mental health, neuroscience, and integrative strategies in a way that's practical and evidence-based, whether you're a clinician or whether you're someone trying to better understand your mental health. In my last video, I focused on magnesium, a very underappreciated mineral. Today, I want to talk about something super easy to measure and to optimize, and what a sea change, and that is vitamin D. The first thing that I want to remind patients and clinicians alike is that vitamin D is really more of a hormone than a vitamin. Nearly every cell in the body has vitamin D receptors, and those receptors are found throughout the brain, throughout the immune system, the skeletal muscle, cardiovascular system, pancreas, reproductive organs. And vitamin D regulates expression of hundreds of genes involved in inflammation, immune regulation, neurotransmitter production, calcium metabolism, and cellular repair. So when vitamin D levels are low, we're not just talking about weak bones, that's kind of what we think of generally, we're potentially affecting multiple organ systems simultaneously. So why should psychiatrists, primary care providers, addiction specialists such as myself, why should we care? Because vitamin D intersects with so many conditions that we treat every single day, and adequate vitamin D support appears to influence serotonin synthesis, dopamine regulation, stuff you've heard me talk about before, neuroplasticity, who doesn't want that, neuroimmune balance, reduction of neuroinflammation. But low levels have been associated with higher rates of depression, of seasonal affective disorder, cognitive decline, chronic fatigue, chronic pain, and poor overall mental health. So it's important to be careful with all of the evidence because association doesn't necessarily prove causation, and it's not an antidepressant per se, but correcting deficiency is an important part of optimizing the environment in which the brain functions. One thing I appreciate most about vitamin D, one of the many things I should say, is that it doesn't just work on one disease. We're not all about the name of the disease. We have root causes that are underneath. So vitamin D helps improve the body's resilience in all of these pathways. It supports both the innate and the adaptive immune system. And rather than simply stimulating immunity, it helps regulate it, reducing excessive inflammation responses, improving our ability to fight infections, supporting muscle strength, balance, bone remodeling, cardiovascular health, insulin sensitivity, and certainly recover after any sort of illness or even after a surgery. In functional medicine, we often really want to think about both root cause and building physiological reserve. And vitamin D is one of the most foundational nutrients that helps the body adapt to stress rather than simply react to it. One difference between a functional medicine approach and simply recommending supplements is that I want objective data. Vitamin D is easy to measure in any regular lab. I obtain 25-hydroxy vitamin D level in every patient that I get labs on, especially patients who have these manifestations of things that can be associated, such as depression, fatigue, autoimmune, osteoporosis, obesity, recurrent infections, chronic pain, substance use. And the within normal limits is what we see all the time, and many labs define anything above 30 nanograms per milliliter as normal. Functionally, however, many clinicians aim to have a little more resilience, a little more reserve, at least around 40 to 60, but oftentimes up to 80, even 100. But we don't want to megadose. We want to optimize, and we want to notice, because when you go too high, you can have toxicities. So we want to both measure the labs and also understand the symptomology. Right, so how do we get patients there? Well, sunlight remains the most natural source, but then we've got geography, sunscreen use, which is what your dermatologist is going to recommend. People with darker skin pigmentation has less absorption, aging, less absorption, indoor lifestyles, all of that significantly reduces vitamin D production. Diet can help, certainly, but modestly only. Fatty fish, egg yolks, fortified foods that can contribute, but not many patients really achieve optimal levels through food alone. So supplementation becomes necessary. Most of my patients require on the higher end of supplementation, but they're seeing me. But most adults require somewhere between 1,000 and maybe 5,000 to 7,000, sometimes 8,000 daily. Although requirements really do vary based on body weight, on baseline deficiency, on absorption, on genetics, certainly, other medical conditions and medications. Patients with obesity frequently require a substantially higher dose because vitamin D actually comes sequestered in the fatty tissue. But the important and simple point is this: we have to treat the patient but follow the labs. I don't use one supplement alone, and I don't have one treatment for one patient or one size fits all. Here's a functional medicine pearl about vitamin D. It doesn't work in isolation. To properly utilize vitamin D, the body also needs magnesium. Magnesium participates in lots of those enzymatic steps, those 300 enzymatic steps in the body, but several of them are required for vitamin D activation. Also vitamin K, that helps direct the calcium into the bone rather than into the soft tissues. So if someone's not responding to vitamin D supplementation alone, I start asking whether we're missing other nutritional deficiencies, such as magnesium and such as vitamin K2. And then we supplement appropriately. All right, so I want to leave you with 3 practical takeaway messages. Well, first, vitamin D deficiency, it's extremely common. And many patients with psychiatric needs, with metabolic issues, with inflammatory disease, with chronic medical illnesses, and more are particularly at high risk. Second, don't assume, measure. Let's know the vitamin D status. Let's understand, and then we can also treat accordingly based on the deficiency. And finally, vitamin D, nope, it's not a miracle cure, but when we optimize foundational physiology, biochemistry, pathways in the brain and body, including nutrition, sleep, movement, stress regulation, and key micronutrients such as vitamin D, we can create a healthier foundation that's more responsive to every other type of treatments that we're trying to provide. One of the themes you're going to hear throughout all of the things I talk about is that optimal brain health doesn't come from one medication, one supplement, or one intervention. It comes from creating an environment where the brain and body can function the way that we're designed to do. And vitamin D is one of those foundational pieces. It's inexpensive, it's measurable, it's generally safe when monitored appropriately, and it has effects that extend far beyond bone health. And if we're serious about improving resilience, mental health, immunity, and long-term cognitive functioning, vitamin D needs to be part of that conversation. Thank you for joining. I'll see you in the next video.